So we are in a nutrition security crisis. We have our house on fire, and we need firefighters such as you all to put the fire out. At Wanda, we like to call ourselves fierce female food freedom fighters. My father was a firefighter at Oklahoma City Fire Department, the first to break the color line back in the early 70s. And so I really take on that spirit of what it means to ensure that we are fighting for food freedom. And that is not only in DC, but in our local communities. And so I'm glad that we have one of the local public health officials here to also engage to talk about why local matters as well in this conversation. And so when we think about nutrition security and the crisis that we're in, we know that people have been fed, but have they been fed well? And we are talking about personalized nutrition to ensure that we are totally optimizing the health and the food that people have access to ensure that it actually speaks to healing us and not killing us. And so for me, this conversation is about the food that we have been eating. How do we begin to change our food system? Earlier talks mentioned about the broken healthcare system, but we also know we have a broken food system as well. And so this speaks to the dynamic that what's the number one health problem in America? Heart disease. My grandmother had a pacemaker. My grandfather had 2 strokes and died. And so the issue of heart disease is huge. And we know that it's totally linked to our lifestyle and our overall health in terms of how we manage stress. And so stress is the underlying concern for a lot of us. We've gone through a pandemic. That was stressful. I had COVID twice along. I totally connected with Thomas when he mentioned about long haul effects and just having the energy to wake up and be here and be present, because we all have a purpose and to make an impact. And so for us, when we think about the stress of everyday life and how that personalized lifestyle matters, food is a critical conversation, but we know we still have hunger in America, and I'm glad that we have Feeding America that will be here to follow today's conversation to understand that we can be fed, but we are not nourished, and that speaks to this idea of the metabolic health crisis that we have in this country, and that we totally need to think about how we redefine changing the healthcare system. To speak to the democracy piece, we have a long history, particularly women, in the fight to vote, of what it means to engage a society that did not want to have you a part of the table. And we have to reflect on that history to understand that the fight is a continuous one for those who fought to vote, to those who fought to have a vote because of their skin color or their gender. And what Bob Kennedy did in going down to the Delta and seeing what was impacting communities of color in particular who were impoverished and seeing hunger full frontal was really when that key pivotal moment that politics began to understand that we have to build the public will to say that we have to have a well-nourished nation. We've seen it from Atlanta to Compton to Detroit to Biloxi, Mississippi, that across this country, we are fighting for food freedom. We know within just the Black community alone, we don't have enough troops on the ground to win the war. We have less than 3% Black dietitians based on the Academy of Nutrition Dietetics numbers, and we also have under 2% Black farmers in this country. And so if we were to think about going into war, having the prepared troops trained with the infrastructure and the equipment, we don't have the diverse workforce, which is one of the key policy opportunities that we push forward in this national strategy that was released by the Biden administration. We understand that when we have good food on the table, that we have a more higher productivity workforce, and we ensure that we have this understanding that everyone matters, and that the Mediterranean diet is not the solution for everyone. And one of the key parts of the national strategy I really enjoyed seeing was the need to invest in traditional foods. When we think about the indigenous communities in our country here in California, as well as my state of Oklahoma, you know, we have a lot of repair work to do, and it starts by investing and valuing that everybody food culture matters when it comes to their food being their medicine. And so I just want to walk you into my community of Anacostia, population about 70,000, that is representative of Ward 8, which is a booming area in Washington, D.C. You think about gentrification, D.C. is one of the most gentrified cities in this country, with swooping crane projects everywhere, to give you a sense of what changes is happening. But this map here that Robert Wood Johnson Foundation, along with CDC, put out, looks at life expectancy across the district. From John Cabin, which is close to the northwest part of DC, you have a life expectancy up to 95 compared to the community of Southeast, which is where the nation's capital is located, is about 63. And this is where we talk about our genetic code is not as strong as an indicator of our life expectancy as our zip code. And so where you live, your place matters in terms of what opportunities you have access to, the access to grocery stores, the access to community gardens. And so we know that the national policies back in 1969 helped to usher in a number of key programs to ensure that our children have food on the table and can eat. We saw during the pandemic that school lunches matter. We need universal school lunch programs in this country. And so this White House conference gave us an opportunity to rethink and reimagine what new policies need to be pushed forward in order for us to ensure that we are moving America as the superpower that we call it into a new future where we begin to see this intersection of food, health, and equity and democracy at play. And so we have SNAP programs that are looking to be modernized, bringing them online. You saw that with Amazon being able to ensure that our low-income families are able to have access to food at the click of their smartphones. And the need to modernize WIC was mentioned at the USDA Nutrition Security Healthcare Summit just yesterday. These are programs that have evidence-based policies and program approaches that can help ensure that we have those programs available for people to thrive. And so when we think about the nutrition labeling, we know that that's going to be changing with the most recent FDA definition around health, given the kind food situation, and that's a good thing because now we are getting more clear on, from a legal standpoint, what does health mean in this country and what do we value when we talk about health. And so the USDA summit that happened yesterday was historical and instrumental. It builds off the energy of the White House conference because it spoke directly to the Food and Nutrition Services program within USDA. I thought it was a bit short-sighted of not having additional agencies like NIFA involved that cover cooperative extension. I was once an extension agent. When you think about FNET programs, which is expanded food and nutrition education programs that basically provide the nutrition education when people don't have the ability to afford a nutritionist to give you the one-on-one support that they need, but you have programs similar to SNAP that offer that through the government. And so it was at least one step in the right direction of bringing health insurance companies, CMS together, food organizations, NGOs, as well as academic partners to say, how can we bring our superpowers together, just like armed forces, Marine, Navy, Air Force, and be able to say we all have our unique advantages, but together we can improve the health and nutrition of this country. And so I wanted to ask today, where are we as an industry, as a profession in this space? Are we choosing to be door number one, simply on the menu? Or door number two, be wanting to just have a seat at the table? Or three, decide to just build your own table factory. This is the conversation we have within Wanda about what it means to say, I don't see my issue on the agenda. You can either agonize or you can organize and you can mobilize. And part of democracy is about understanding that we all have to participate in this society to create the change that we want. If you don't see your issue, that means you need to build your coalition, you need to set your agenda, and you need to call on your policymakers to say, hey, midterm elections are coming up. Where do you stand on this issue? If you don't stand, I'm gonna get people to vote you out. It really is, it can be that simple. We know it can be complicated like relationships, but this is the nature of what it means to do the dance of politics, and understanding that we have to have a policy agenda. And we started that by understanding that we created the State of Food Democracy Survey through WANDA with the help of Food Tank, got about 1,000+ responses asking people, how do you engage the food system in terms of being able to organize, sign petitions, make a petition, get people out to the polls. And we learned that, one, people definitely saw themselves as food citizens and the need to engage in a food system in a way that they haven't thought about it before. It's not simply enough just making choices at the grocery store, but it also is understanding that I need to actually understand where do my political representatives stand on these issues, if they stand at all. And it was clear that in asking, do you believe that we need a food bill of rights? That majority agree, yes, we do. Because when we have a conceptual framework, a unifying document, it gives you a roadmap of the direction that we're headed. And right now, we've had piecemeal policies that ensure that we are not making the root causal change that we need. We need a paradigm shift. That conference of the White House was a critical part of that, but it also stands to change with new administrations of their level of will and commitment. And so having a food bill of rights is very much what we should have signed on with the right to food with the UN Declaration of Human Rights, is recognizing that we need a unifying document to guide the future food and nutrition policy in this country. And so in the end, I will implore that you support this idea that you are a food citizen, that you do need to exercise your vote, your right to use your voice beyond just the clinic situation, but you need to engage policy. And so we've created sisterhood suppers to engage women who are physicians, who are healthcare providers, who are just everyday women, to say, what are the mechanisms at your local level, whether it's a food policy council, that you can use your voice on these issues. And it was clear that being able to create our own tables, have those conversations, it sparks the discourse and it begins to build the public will to say, I never thought about that. I want to be able to support change in our local communities. And so one of the things that we need, every city needs a local food policy council. So you have a mechanism to give policy recommendations to your local officials to understand, like, these reports that we're producing speaks to the evidence-based policies that we need in our country. And in the end, my own personal story here is my grandmother, who's 95 in Oklahoma City, along with my aunt and her sisters. And I think about my grandmother, Ruby, who my daughter is her namesake, 30 years in pediatric and geriatric nursing at OU Medical, and realizing that even though she's had diabetes, she's had stroke issues, that she's been able to overcome and outlive husbands and sons because, one, she's a faith-driven woman, but also she understands what it means to manage her own lifestyle and health and stress. And it's a real fortitude and a testament to what it means to just understanding that you have to take your life in your own hands and use the resources around you. And so I really give a lot of my just motivation when I think about Ruby. And this is my daughter, Ruby, who had the opportunity to see First Lady Michelle Obama at the US Women Summit years ago. And that image for me was just like looking into the window of the future when we want to inspire the next generation of food freedom fighters to say, if we don't make the changes around food democracy now, we have a generation that will be impacted by the decisions that we make or don't make today. And so that is why having our children involved in this food fight is so critical. I've had Ruby to testify on nutrition security legislation just last year with our DC Food Policy Council. And though that legislation didn't move forward, it motivated Ruby to run for student council this year. And though she did not win, she has learned the lessons of most adults don't learn, that you still have to keep doing the good fight, because every test is a test of your conviction. And that is character development that we need more than ever. And so we have a defining moment. And in this defining moment, I call upon you to see yourselves as a food citizen and to vote with your forks, engage those who stand in the way of either harming our food system or healing our food system. We have the political will at the Biden-Harris level, Booker, McGovern, even Susan Rice with the Domestic Policy Council, but what happens when they go? And so this is why the work is local, it is national, and we have to continue to ensure that we play a critical role in understanding our mission is critical. When we think about Wanda and what we're doing in bringing women and girls together to see themselves as these food heroes, it starts with us, even as NGOs, of how are we building into the movement, of ensuring that those who have been left behind, who've been hidden figures in the food system, are part of the change that we wish to see. We know that Black women have not been historically engaged in a way that they should. And we understand that they have a critical role to play, not only in saving democracy with the most recent election, but also when it comes to saving our food systems because of the nature of why we were brought to this country, to help build a food system, to ensure that we are part of the culinary currency that flows in our veins, that we're part of not only the labor force, but the decision-making table. It's so critical to ensure that equity is not simply just a shift of power and resources, but is also making sure that if we're not at the table, we will have to build our own table factory. And that's what food sovereignty looks like. And that's the other part of food democracy, is having a choice. If we don't like the food system that we have, we should have the option to build alternative food and health systems that we have seen across this country, from the community gardens, the work that Ron Finley has been doing in LA, as well as those such as Tabitha Brown, leveraging social media to engage a following that hasn't been engaged around the vegan movement. This is what alternative networks look like, and leveraging technology and leveraging your voice. And so the future of food and nutrition policy and democracy is at stake. And the decision that you make today will determine what that future will look like. And so I want to continue to implore this idea that you are a part of a food democracy, whether you realize it or not. Just as people who don't choose to vote in November, they're a part of the democracy too. They exercise their voice to not vote. But in the end, America's like a membership benefit club. You could choose to use your benefits or not, but you're paying for the benefits, so you might as well use them. So, menu, table, choose. Every day you have a choice. I'm making my case for you to make the choice. If you can sign the petition at iamwanda.org/Food Bill of Rights, that's a choice of going in the direction of being that food citizen, of saying to President Biden that I believe in a Food Bill of Rights, that I believe that we should have a unifying document that speaks to the nature of our food policy systems, that's saying that everyone should have a right to have access to healthy, affordable foods, and that we are part of the change that we need. It should be a part of our livelihoods. It should be given respect and dignity when it comes to access to our food systems. So in memory of my grandmother, who died from diabetes complications back in Oklahoma, Minnie Mae Crawford, I honor her life and her legacy, that she's planted that seed in me, and understanding that her lifestyle, which was built around trauma, is very much different than Ruby's lifestyle. And so every day I think about the tale of my two grandmothers and the choices that they've made in their life, and her life will not be in vain. Thank you so much.